Good day everyone. So today we are from group 3 are going to present our presentation for medical coding 2 chapter 14 disease of genitourinary system. First of all, I'm going to tell you what is genitourinary system disease. The genitourinary system are the organs of the reproductive system and the urinary system. Organs of the genitourinary tract include the kidneys, bladder, fallopian tubes, and penis.
I will present about disease of the genitourinary system with code block N00 until N08, which are glomerular disease. The block of codes for glomerular disease for reports nephritis. The coder may also encounter the term nephropathy as the synonym for nephrosis. This is a block title under code of N00 until N08. Next, I will present about renal tubular interstitial diseases, which in category codes N10 until N16. Also codes various forms of nephritis. To code two categories N10 until N12, the coder needs to review the documentation to determine whether the condition is acute or chronic. As you can see from my slide, this is a block title under the code range N10 until N16.
So next, let's move to the next disease in this chapter, which is acute kidney failure and chronic kidney disease, which the code plot from N17 until N19. We apply N17 code for acute kidney disease, N18 for chronic kidney disease, and N19 for unspecified kidney failure.
Urolithiasis, which is code blocks from N20 until N23. This block of codes reports for calculus of kidney and urethra, calculus of lower urinary tract, calculus in urinate tract, and disease classified elsewhere, and lastly, unspecified renal colic. Kidney stones are also called urolithiasis, are hard deposits made of minerals and salts that form inside our kidneys. Diet, excess body weight, and some medical conditions and certain supplements and medications are among the many causes of kidney stones.
In this chapter, we will also give code for other disorder of kidney and urethra, which are code from N25 to N29. We use code for N25 disorder resulting from impaired renal tubular functions, N26 unspecified contracted kidney, N27 small kidney of unknown cause, N28 other disorder of kidney and urethra, no elsewhere classified, and lastly is N29 other disorder of kidney and urethra in diseases classified elsewhere.
For the other disease of the urinary system, which is code blocks from N30 until N39. For the code N30, we have cystitis, and for N31, we have neuromuscular dysfunctions of bladder, not elsewhere classified, and for N32, other disorders of bladder, N33 bladder disorders in disease, N34 urethritis and urethral syndrome classified elsewhere, and N35 we have urethral stricture, N36 other disorders of urethra, N37 urethral disorders disease classified elsewhere, and for last but not least, N39 other disorders of urinary system.
In this chapter, we also have disease of male genital organ, which is the code block from N40 until N53. This disease relate to the male reproductive system and male reproductive organs. This plot reports enlarged prostate, and inflammatory disease of prostate, hydrocele and spermatocyte, non-inflammatory disorder of testis, orchitis, and epididymitis, male infertility and oligospermia, disorder of prepuce, penis, and other genital organs, male erectile, and sexual dysfunction.
Next, I will be explaining about the breast disorder which are coded from N60 to N65. There are several types of breast disorder found in teens and young adults. Most of these conditions are benign or non-cancerous. The most common types of breast pain is associated with swelling of the breast tissue during the menstrual cycle. So, the medical code listed for disorder of breast are N60 benign mammary dysplasia, N61 inflammatory disorder of breast, N62 hypertrophy of breast, N63 unspecified lump in breast, N64 other disorder of breast, and lastly N65 deformity and disproportions of reconstructed breast.
Next, in this chapter, there are also disorders named non-inflammatory disorder of the female genital tract with code plot from N80 until N98. This disease or this disorder relate to the female reproductive system problems such as endometriosis, which is with code N80, other in non-inflammatory disorder of cervix uteri, which is the code is N88, and excessive frequency and irregular menstruation, which is N92.
Next, for the intraoperative and post-procedural complications and disorders of genitourinary system, not as well classified, which is code for N99. The code descriptions need to be read closely because at times the codes differentiate between males and females.
So, next, I will explain about the ICD-10 guideline for stages of chronic kidney disease. So, chronic kidney disease is divided into 5 stages. The ICD-10 classifies CKD based on severity. The severity of CKD is designed by stages 1 to 5. Stage 2, code N18.2, equate to mild CKD. Stage 3, code N18.30 to N18.32, equate to moderate CKD. Stage 4, code N18.4, equates to severe CKD. And lastly, stage 5, code N18.6, end-stage renal disease, is assigned when the provider has documented end-stage renal disease.
Next, I'm going to provide an example on how to code for guideline 1, which is the stages of chronic kidney disease. Example 1. Devi is diagnosed with chronic kidney disease stage 4. This will be coded with code N18 with 0.4 chronic kidney disease stage 4. For example 2, Suji is diagnosed with end-stage renal disease. The patient has not started dialysis yet. Currently, this will be coded with code N18.6. Then, when the dialysis is started, Z99.2 will be assigned as an additional code to identify the dialysis status. For the second guideline, chronic kidney disease and kidney transplant status. Patients who have undergone kidney transplant may still have some form of chronic kidney disease because the kidney transplant may not fully restore kidney function. Therefore, the presence of chronic kidney disease alone does not constitute a transplant complication. Assign the appropriate N18 for the code code for the patient stage of chronic kidney disease, and code Z94.0 kidney transplant status. If a transplant complication such as failure or rejection or other transplant complication is documented, see section 1.C.19.G for information on coding complication of a kidney transplant. If the documentation is unclear as to whether the patient has a complication of the transplant, query the provider. Here is an example cases for the second guideline. For example 1, if there is a documentation that a patient who has severe CKD or ESRT with a kidney transplant is having transplant failure, rejection, or some other transplant complication, code T8.1 complication of kidney transplant is assigned. For example 2, a patient with a history of kidney transplant admitted to the hospital with acute renal failure due to dehydration is assigned codes T86.19 other complication of kidney transplant, N17.9 acute kidney failure unspecified, and E86.0 dehydration.
Kidney disease with other condition. Based on the guideline, patients with CKD may also suffer from either serious condition even though they already got the transplant status. Most common are hypertension and diabetes. For example, for hypertensive chronic kidney disease, we must code first for the hypertensive, and next for the SD, we need to find the chronic kidney disease for stage level for the patients. The sequencing of the CKD code in relationship to codes for other contributing conditions is based on the condition in the tabular list. The example cases is example 1. The patient suffered from hypertension. At the same time suffer from the kidney disease. In this case, I12 code, which is hypertensive with kidney disease, should be assigned as the principal diagnosis. Example 2, if the patient has reached the need for dialysis, then this is coded in ICD-10-CM with N18.6 bracket ESRD. In conclusion, genitourinary can be defined as organs that involve in reproduction and urination. As shown on the video, we have discussed coding guidelines related to genitourinary disease. That's all from us. Thank you.